you, Dr. Tedros, for taking the time out to speak to us today. I know you have a busy schedule, but this is an important day for us. It's an important day for the nurses of the world. It's the International Nurses Day. It's also the year that you designated in WHO as the year of the nurse and the midwife. It's also the bicentenary of Florence Nightingale. And it's turned out to be a year that's very different to what we anticipated in celebrating. But I'm wondering, what message do you have for the nurses of the world?
Yeah, thank you. Thank you so much, Annette. First of all, I would like to say happy International Nurses Day. And I say this as part of the nursing community because, as you know, I am honorary nurse and, of course, midwife. So it's such a great honor. And on behalf of WHO's Chief Nursing Officer, Elizabeth Airo, my colleague, and all my WHO colleagues, I would like to say thank you to the world's nurses for their commitment. I'm sure Florence Nightingale would have been very proud of how the profession has developed since her pioneering work. By the way, this year, when we open our new building, the plan was with you and others to have a statue of her in our new building, and hope when this COVID is behind us, we will do it. And I know Nightingale will be, her statue will be in our building to represent the sacrifice and service of all nurses. And I really look forward to that day when I join you and others to celebrate and put that statue in our new building. It will be an incredible moment. And every year, as you know, nurses provide care, comfort, and treatment to patients in every part of the world. And this year, of course, they face an incredibly demanding situation as they help to tackle the COVID-19 pandemic. And International Nurses Day is a time to recognize all that nurses contribute each and every day. I know your Nursing the World to Health report, which is launched today, will provide significant evidence for the importance of investment in nursing, the state of the World Nursing Report. And would be happy to discuss about that to my sister Annette.
Thank you, Dr. Tedros, and thank you for saying that you are going to have a statue of Florence Nightingale in your building. That will be very much appreciated by all the nurses. And as you know, I'm sure she's wondering why, when she did in about 160 years ago, spoke about hygiene and health promotion, disease prevention in the Crimea War, why we still haven't continued that today, because that's so important. But somewhere we lost our way in that. So yeah, you know, it would be a great idea to have her, and we'd be delighted to come and launch it with you. But as you say, this was a year where we have had a lot of contact. We've had a lot of work, the year of the nurse and the midwife, but we've also had a lot of work over the years with primary health care, with talking about universal health care, talking about non-communicable diseases, elderly care, vaccination, all of those areas we've worked very hard on. I think we were the first NGO to join WHO. But the highlight of this year, certainly for nurses, was the launch of the report on the state of the world's nursing. And we certainly thank you for commissioning that. We worked with you on it, and we are delighted at what the report contains. It gives us a platform for all the health policies recommendations in it. And we're wondering what you see as the importance of it and what you see going forward will help in investing in the health service and investing in nursing.
No, thank you, Annette. ICN has been a valued partner of WHO, as you know, and as you said. and the first one. And I'm really grateful for the support ICN has provided to me and my colleagues. And the Year of the Nurse and Midwife is an important milestone in the history of the professions. It acknowledges their incredible contribution to the world's health, and I hope it will encourage the recruitment of a new generation to carry on the excellent work that nurses and midwives do. The State of the World's Nursing Report is the first document to provide a snapshot of the global nursing workforce. It highlights the scale of the challenge we face, and a shortfall of 6 million nurses is a problem we have to solve. It also provides a roadmap for governments to invest in nursing, to fill that gap and progress towards universal health coverage. So back to you, Annette, but I'm really excited that we have this first report. And from WHO side, in partnership with ICN, we would like to have the State of Nursing annual report, actually. And I hope this will be the start and, but not the end. And I'm really glad that WHO and ICN are actually pathfinders in starting this report, and it will help the world in addressing the challenges, but at the same time using to the max the potential that nurses have to our health systems, especially now during COVID. I think the world will understand the value of our nurses and other health workers and why we should really take bold measures to prepare our health system and have strong health system in each and every country. Thank you, Annette, again, and back to you.
I think, Dr. Tedros, if I remember rightly, the first time I met you, you said, without health, we have zero. We have nothing. And I think that's true today. And you're right. And I hope that I've always asked for the fact that after this report, that we would monitor the situation on a regular and a yearly basis. And I thank you for saying that we will do that on a yearly basis. And although COVID-19 has cast a shadow across the world, it has made a difference for everybody, everywhere. Things that we took for granted, like going for a walk, like going to work, like going to school, like health, now has become a value. And it's so important that we protect and value the frontline workers, that we ensure, and I know that you and WHO have been aligned with ICN in their thinking of the need to protect the frontline workers with protective equipment and with support for their mental and physical health, and for the need for testing, particularly priority testing with healthcare workers, and collecting the infection rates and the deaths. It is so important that we know that, because that helps us with prevention and it helps us to prepare. But what more can we do, and how can we show that COVID-19 needs to show the world that we need stronger healthcare systems and that we need to invest in nursing? Because we have seen in various countries throughout the world, we've called for people to come back into work from retirement. We have called for the students to come back into work. So it's obviously we need investment in nursing and in healthcare.
Yeah, no, thank you, Annette. As you know, this virus is new, and not only that, this is a pandemic that was caused for the first time actually by a coronavirus. And not only that, there were many unknowns at the initial stage of the pandemic. Of course, we know more now. And not only we know more, but if I just say just one thing about this virus. It really moves fast, and it also is fatal. So it has these two combinations. Flu basically moves fast. It's very contagious, but it's a less killer. SARS doesn't move fast, but it's a very serious killer. And this virus, this new virus, COVID-19, has both elements. It moves fast, and it also is a killer. And we were discussing with our colleagues, and we said this is a virus which is fast and furious. I don't know where they brought it, but fast and fatal. And that's why now this COVID has focused all our minds on healthcare like no other event in living memory, because it's really fast and it's also fatal. And that's why the whole world is on a lockdown. The pandemic respects no borders, and its fast spread and the damage it can do will only be reduced if we have strong health systems with sufficient numbers of well-trained nurses and other health professionals, a resilient health system, flexible enough. And when a virus like this with many unknowns comes, that we respond fast. And we need greater investment in nursing and healthcare, and not just during crisis. And we have to do it well in advance. And ICN and WHO are saying many of the same things about protecting our health workers in the context of COVID-19. The provision of personal protective equipment for all staff who needs it is paramount, as you said. And both organizations recognize the necessity for global solidarity and cooperation. Of course, that should be based, or it should be on a strong foundation of national unity. And we agree that countries need to collect more data about infection rates among healthcare staff and the number of nurses and other healthcare workers who have sadly lost their lives to the infection. Such tragic deaths must be commemorated appropriately when the time is right, and remind us how fragile we are if we are not properly protected. Annette, is there more that you think we should be doing? I would be happy to listen to you.
Thank you. And I agree with your comments about the need to collect information on healthcare workers, and particularly those who died. Yesterday, we would celebrate and in a memorial ceremony, lighting candles to those that died, the nurses who died, because they're not a statistic. They're an individual with parents, with their mothers, fathers, wives, husbands, sons, daughters. They need to be remembered as individuals, as people who gave their lives for in the care of patients. So it's very important that we collect that information and that we remember them, and that in memory of them, that we do better in preventing other healthcare workers, and that we do better in preparedness. And I hope it calls the countries into a state where they will prepare now and in the future, because we are still hearing from our NNAs, our National Nurses Association, that they're still short of PPEs, and they're still not getting the support that they need. And there is a lot of violence against the nurses that are going in to work. They're getting abuse because of the fact that they're working with with COVID-19 patients. That's not right. So yes, we need strong healthcare systems, and we need, and we're grateful for you, because we need leadership for appointing Elizabeth Iro as chief nurse. But we need chief nurses in every region, and we need chief nurses in every country. And if we've seen anything during COVID-19, we have seen great leadership among the nurses across the world. We've heard from our national nurses associations how they're working with governments, they're working with stakeholders. everything to protect their nurses, to educate their nurses, to educate the community. And it is extraordinary. And as one nurse said to me, give a challenge to a nurse and you will see the greatest in leadership. But we need them involved in policy. They're 59% of the workforce, but they're not involved in policy. So that's what I would say. But I could say a lot more, but you know, that would take another day. But thinking back to happier times and thinking back, it's hard to believe that it's only a year since we were in Singapore and that we were very happy and we were celebrating and we were thinking about the year of the nurse and the midwife and how we would go forward and how we could showcase nursing. Well, I think COVID-19 has done that. It has showcased nursing. We wouldn't wish it, but it has done that. So as we head towards next year and better times, and we know that we will win the fight with COVID-19 because as our theme for International Nurses Day says, nurses nursing the world to health. We will nurse the world to health, and we will be instrumental in nursing people to health in COVID-19. I have no doubt in my mind about that. It will happen. It's about solidarity. And that's what we're seeing with nurses. If nurses can show anything, it's that they can show the solidarity among the nurse family of the world. That's what I have seen in the last few months, and the cooperation and the sharing of information. And I'm so proud of them. I'm proud to be a nurse at this time. But back to the request, and the request is for next year, because then we will celebrate in Abu Dhabi in 2021 in June. And we would really like, I know you made a great effort to come to Singapore, but we'd really like you to make an effort to come to Abu Dhabi in 2021.
Yeah, thank you, Annette. Thank you, my sister. It was genuinely actually nice that I was able to attend your Congress last year. If I may say, I was so privileged actually to join you. And seeing so many nurses working together and celebrating their great profession was very, very gratifying. And you know, I remember there was a wonderful energy in the conference center, and that really was circulating actually, and that lifted all of us up and inspired all of us. And I was so happy to be there, to meet so many nurses and to demonstrate that nurses are central to WHO's work in caring for the world's health. As you know, as a nurse, as a Minister of Health in Ethiopia, I have been working mainly on primary health care. And I was very, very close to nurses. And I know, you know, their contribution to society, nurses as a bridge between the health service and the community, and the sacrifice they pay. And for me, you don't need to thank me, being with them, thousands of them, attending their annual gathering in one big room, and me joining them was actually an honor and privilege. So I would do it again. And now I think you will be having your next Congress. And I think that will be, where did you say?
Abu Dhabi, June. And we'll give you a choice of 3 days.
Yes. So what I would,
nurses out there knowing that I've asked you, so it's going to be very difficult to refuse.
Yes. So what I will say is, for sure, you will have a big surprise. I think you understand what it means.
I do. I understand the big surprise, and thank you for that. Yes.
Thank you. Very big surprise. A big one. Very big, bigger than the Singapore.
The last one.
Yes, yes. We have to grow.
Yeah,
we have to do more.
You know, nurses have, I suppose, shown great courage and great resilience and great professionalism. And it's been a tough, and will be probably a tough year. And we promised them celebration, but I want to promise them celebration next year. And I will honor that promise. They deserve it. They've worked to it, and they need it. That's for sure. So we have to celebrate. And COVID-19 will end. I have no doubt in my mind it will end. It's up to us all. Everybody has a role to play in actually curbing this epidemic. So we will, and we will win. It's about solidarity. So thank you very much, Dr. Tedros. I know you've taken time out of your busy schedule. And on this very auspicious day, I wish you a happy International Nurses Day.
Thank you so much. On this very special day, I would also like to say Happy International Nurses Day and much gratitude from me and much respect to each and every nurse, starting from you, the President. Much gratitude and Happy International Nurses Day. Thank you.
Thank you, Dr. Tedros.
Thank you.